Can I, real quick through to make sure that I have everybody present who is supposed to be present?
Okay, go ahead.
I know it's abnormal for, so Jason White.
Here.
I know you're on there, Jason. Lori Halsey.
She's down there.
She said she's muted.
Okay. Dr. Wingert.
Yes, I'm here.
Dr. Morris.
Here.
Dr. Ruddy.
I'm here in my den, and I get done with my dinner.
No
Whole
problem.
face now.
Donna Jackson.
I'm here.
Kathleen Bennett.
Yeah.
Dr. Ralph Ruffin.
Present.
Dr. Daryl Nelson. Dr. Don Potts. Okay. You have your quorum.
Hey,
Okay, very
Christina, who's
good.
our city 7?
What?
Who's the person in here that says city 7?
I believe the mayor wanted to listen in on the call.
Okay.
I move to approve the minutes from the February meeting as presented.
Second.
Okay. All in favor, say aye.
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 Aye. I'm assuming that's going to be acceptable. I didn't hear every individual aye, but okay. Let's go ahead and with the meeting agenda. Welcome everybody. This is going to be a unique experience for us, and we're going to have an opportunity to do something kind of well, obviously different for each of us. We've never had a meeting. This will be a first time for the Independence Board of Health to have this type of meeting. So, but then we also are in a unique time frame. We've had a unique experience going through this. The irony is that it's not just for our community, but the world over, which is hard to believe that it's such a major event that we're talking about. We're not looking at just a simple little unique experience. The world as a whole is joined in with us on this particular event, and appreciate the mayor's interest in our board. And but we also are supportive of the mayor. We appreciate all that you've done, and the city officials, and how hard Christina's been working and to keep things moving along and everything that needs to be done taken care of within the auspices of all the unique restrictions that are in place. So at this point, is there any other comments that anybody wants to make before the meeting gets underway?
Can I make a quick reminder to everyone who I'm sure you guys realize it and that everyone will not have an issue, but this is being streamed live on YouTube and will be recorded in there. So just so everyone is aware.
Okay, great. Thank you, Christina. And welcome, Mayor, to the meeting. We appreciate your being here and participating, and you're always welcome to make a comment if you have something you'd like to contribute. Christina, would you like to go ahead and share the information that you have for us?
Yeah, so as you guys know, of course, we are under a state of emergency, and there's currently a stay-at-home order, which right now is slated to end on May 15th. There are a lot of factors that go into how that date was decided, and how we are going to decide to move forward from here. You know, as I've told a lot of people, you know, May 16th, life isn't going to return to normal. We don't get to just, you know, hit a light switch and everything's going to be perfect again and fine. You know, we're looking at a lot of modeling data right now. We're best to take in as much data as we possibly can that's made available to us. Across a lot of very smart people are saying, you know, you can't open back up until there's adequate contact tracing. There's, you know, there's a low number of cases. There's enough hospital beds and a capacity to handle the number of cases that are coming in, that there's enough equipment like PPE, and that we're doing enough testing to know that there's a low number of cases. Some of those things we as a region are doing okay at. Some of those things we're not. As the board, of course, is very well aware, a few years ago, the city transitioned our health department. And when it came to things like epidemiology, those responsibilities transitioned to the Jackson County Health Department, which handles Eastern Jackson County now. We've been concerned. They have a very small health department. I believe there's 13 staff members at last count, and they have a large population. There's, you know, we have some definite concerns when it comes to contact tracing to make sure that that's being done. You know, as an area, we have a lot of concerns that we don't have enough tests. I know that it made the news recently that some local businessmen pulled resources together to purchase 50,000 tests for our area, and had teamed up with KU to get those tests distributed. What that means is every regional health department in our area is allowed 25 of those tests a day. 25 tests is not a lot for Eastern Jackson County. It's just not. The aim for the state is, you know, closer to more like 10,000 a day, and 25 is not enough. And for our population size, it's just not enough. So in all honesty, you know, we as a city have had some definite concerns that we've shared. We've had some wins, which we're very happy about. But, you know, we would like to do more, and we would like to be more helpful. And I'm just not sure that we're there yet.
Mr. Chairman, could I ask some questions, sir?
Sure, go right ahead.
First of all, I appreciate, you know, the way the city's conducted that. And you all know me well. If I'm not always the best cheerleader for things, I'm okay with challenging the world. And I have to say, I thought the city did a good job at announcing early on and fairly and appropriately the stay-at-home order and the shelter, the social distancing, and implementing those things. So I appreciate where we've come from, and I appreciate the opportunity for you all, because I often I'm outclassed in this board. I tell people this is really a very good board that presents quality information and insight to the city, not because of me, because I'm a layperson, but because everybody else's pictures up there is a nurse or a doctor. And that brings a phenomenal amount of expertise and understanding to ask the quality questions that it's important, especially in this kind of a situation. I am curious, can you walk through for us what are the numbers regarding independence, as far as I don't think I've ever seen it broken out for independence as to number of cases and number of fatalities, and then has it? I was on a call with the state health department not long ago for my work, and they indicated they thought we had peaked as a state. And I respect there's different components of the state. So are the trend lines instructive for number of cases and number of deaths in Jackson County, and particularly Eastern Jackson County? And then can you raise questions on the contact tracing? If you could walk through what is the plan for that? It didn't look like it was difficult training, but it needed a lot of people to be available to do that work. So might you walk us? So I guess I'm curious, do we have any numbers? Can you provide those? And do we have, what is the contact tracing plan? Thank you.
Yes. So for Independence, the county is not releasing city specific data. They are releasing by zip code. But they feel very strongly that they should not release city-specific information. I do have it because it was provided in order to make sure that our public safety personnel going to specific addresses are aware before they arrive at an address if a person is confirmed case at that address. However, I'm not allowed to share that. I can also tell you that they have not shared that information with me. They have not shared that, to my knowledge, with anyone within the city of Independence, so I can't answer that. Concerned with HIPAA regulations, and they aren't sharing. I can also tell you I have no idea how many tests have actually been performed in Eastern Jackson County. One of the criteria is to make sure that we actually have a low incidence of cases. A good way to measure that, there are several ways. One is you either need to test a ton of people and make sure that most of them are negative. Or when you're testing, you need a very low number to be positive. So the number I've seen thrown out there is it has to be below 10%. The number of total tests, performed in the nation and performed at the state level, we know that. We know that in the United States, around 20% of the tests are coming back positive. In the state of Missouri, a little over 10% are positive. For our region, I have no idea. That information has not been provided to us. We would love to be provided.
I think it's important to point out here who's being tested. My friends that are still on the front line, not working in the emergency rooms, but are in the physician offices, essentially have no testing material. So if a patient calls up and they have symptoms, they're sent to the emergency room. And I wish Daryl could be here tonight. And they are.
Hey, Terry.
Yep.
Hey, it's Daryl. I actually finished up my other call. I told Christine we had actually a citywide call with all of our medical staff, and it ended early, so I got on just a few minutes ago.
Maybe you can answer this for me, because in another system, my friends send their patients to the emergency room. The patients, at least this is the literature that I'm seeing, the patients that are tested are the ones who are ill enough that they may need hospitalization. If you call up and you say, I have a fever 102 and I feel like crud and my chest is tight, but I'm breathing normally, most of the triage people tell you to stay home. And I don't know what the protocol is for HCA. I've heard some rumblings just from friends that are still in the practice, but you might talk about that. And that's really the problem I see with testing, is that we're not testing a representative percentage of the population. We're testing people who are already sick as hell.
Yeah, happy to help. Good evening, everybody. Daryl Nelson. I'm the Chief Medical Officer at CenterPoint and been in a number of conversations, as all of you can imagine, over the past many weeks. And just a part of the conversation I can pick up on, I would echo that there is just a tremendous disconnect between certainly the national and probably even some of the regional press as it relates to where testing is, at least in our part of this country. And Christine approached us in a collaborative fashion some time back to try to set up some community testing strategies. And we unfortunately had to say, from not just a CenterPoint, but a HCA health system, which is 6 hospitals in Kansas City and 9 or 10 if you count some rural hospitals that we operate, that we just didn't have capacity for testing as an independent health system. And in addition, we were collaborating with the local and the state health departments following the criteria that you just heard Terry reference, which have been incredibly restrictive. And it is somewhat ironic if you think about our positive testing percentages being what seems to be relatively low, between 5 and 18 or 20%, depending upon what data set you look at, when in actuality, we're only testing the sickest of folks. So the guidelines we've had from the health department are, if patients arrive in our emergency department and are sick enough to meet criteria for admission, which are breathing rate, fever, heart rate, some of the basic vital signs, and then a subset of symptoms, then we can admit them and test. But if they do not meet criteria, just as he articulated, we are to triage them back home with supportive care guidance and instructions to return if they get worse. Obviously, that doesn't sound right to any of us. In my 30-some years as a primary care doc, I've never been faced with a scenario that was really my option. So there's not been a lot that's been health system specific. If you're engaged in collaborating with your health department, and I'm not passing the buck, I'm just being honest with all of you, there's a fairly defined set of criteria that you're supposed to utilize. Now, some health systems, granted, have found their way to some private testing resources and are in the media. And it's interesting because when I'm on the citywide call with all of my CMO colleagues from all the health systems that you see and hear about in the news, the story amongst us is really pretty similar. But there are scenarios, I think, where folks are trying through private access to stand up testing. And it's just been a tremendous challenge. We're starting to get a little relief and have got a couple of testing scenarios that we're getting online, but it's been really difficult to get at. Just to give you some numbers, we don't publish them either. Most everybody is really uneasy, but I'll be honest with all of you. We've seen 85, no, that was last week. It's probably 100 patients who presented that were sick enough to be admitted. And so we define those in the public health terms of PUIs, patients or persons under investigation. And those 100 and a few were sick enough to be admitted. And of all of those to date, 12 have been positive. So we're running 10% of testing people sick enough to meet criteria to be admitted to the hospital. So I think it begs a lot of questions about how and if or when we can really move forward, to Christine's points, because if you look at the guidelines, you need to be able to show downward trends. I will tell you, when we look across our health system, we do have a downward trend now for the past 7 days. We just looked at the data on the call I just came off of, and it is trending slowly downward. That's across 6 hospitals that sit on both sides of the state line for HCA. So that's just internal data from that standpoint. There's about 24 or 25 patients currently inpatient right now, just in our system, primarily at research, who are positive. So we are seeing what we think might be some peaking, at least of that subset of patients who are sick enough to require hospitalization.
So, Daryl, those stats you were giving me was for the HCA Midwest division, right?
Actually, the Kansas City market. So our division includes some hospitals in the South. So that's the Kansas City market data, that overall trend, and then that 100 with the 12 positive, that was CenterPoint specific.
I part of what I was glad we ended up having this meeting this evening was an opportunity to sort of convey the sense of the expertise of you all to the citizens, because and I don't know how many will watch this on however you do this, 7 or YouTube or whatever that thing is, but I think the educational opportunity is good. I would tell you, I got on this call assuming, because I was pleased with how the city had reacted, but now that listening to Dr. Nelson and Dr. Morris and Christina, I'm sitting here scribbling my normal back to challenging the status quo. So we're the consensus seems to be from the medical expertise around me that we don't have adequacy of testings yet, and we don't have a good understanding of, we have a system-wide trend, but we don't have trends within the broader community that we're aware of. We're not aware of what the contact tracing plan is supposed to be, and yet we're, you know, and just the general chatter in the community, there are people expecting, you know, the community to open up fairly soon, and I'm not qualified to say what that means or doesn't mean, but how do we help explain to our neighbors through the existence of this body how to determine when it's really appropriate to try to start getting back to normal? I mean, I appreciate Dr. Nelson's assessment, but I sort of figured Christina would have the numbers, and I'm as we've had before, I've not been overly thrilled with some of the things from the county health department because of childhood vaccinations, and so, but I'm not. I guess I'm not real impressed that we're sitting here supposed to be providing advice back to the city government, and we don't have data that's clearly available. And I would respect institutions like the HCA Health System's interests with regards to that data, but aggregate data is not protected by HIPAA. In a prior life, I was a HIPAA privacy officer, and I still maintain marginal competency, and there have been waivers from the Civil Rights Office. And so I'm unimpressed with that as an argument, and it's completely wrong in an aggregate fashion for release of that. And you could certainly aggregate Independence at 120,000, or at least Eastern Jackson County, and provide numbers of tests, numbers of positives, numbers of deaths, and trend lines. Dr. Nelson has it at his instant disposal from one of our major health systems. Surely the county has it. So I was expecting a positive conversation this evening. So,
Well, and the honest answer is,
Hey,
I'm sure the county does have it. And we have made a very similar argument. And we will keep requesting information in order to be able to lead our city.
One of the things that I was considering is that I thought that the request for another additional 2 weeks is a significant time period, but obviously when you're looking at this kind of an issue and a situation, the 2 weeks gives you an opportunity to, you can more easily backtrack and, you know, cut it short versus making it longer. I think the psychology behind the idea of making it go longer, if you come up short on the amount of time, then obviously the citizens are, you know, get excited about the opening and getting back to business as usual. But if you have a longer time period and then things are looking good and you have the opportunity to take and cut it short, instead of 2 weeks, you end up maybe with a week or a week and a half. You know, the shorter time frame is easier and much more plausible and acceptable way of approaching it. And I think that's an advice. I recommend that. I think that was well decided, but it's still what are the justifications for the 2 weeks is something that I think Jason's right. It needs to be, it'll make the whole proposal that much easier to accept and, be endorsed.
Well, and the
Yeah, I
justification for
struggle
the
more.
sorry, no, go ahead, Dr. Reddy.
No, yeah, my bigger concern with this is I know that this is meant for consumption by folks in independence, but to think that we're confined to independence and that we don't consider this regional approach and the cooperation that needs to occur among all the jurisdictions that are impacted, it just seems silly to me to have isolated discussions. And we know that people are going to start breaking free of this, or there's going to be pressures to. And I would hope that the government entities, the folks that make these decisions, and I'm not in general, I'm saying that in the largest context, that there is a regional approach as opposed to this city by city, county by county. It's silly to think that it's going to confine itself to Independence or Liberty or Johnson County for that matter, whatever the case may be. That concerns me.
Well, and the region as a whole does have what they call a MAC group, which is made up. It's Mark, the Mid-America Regional Council, went ahead and set up essentially this group that has everybody participating and has representation. And that was the idea, was that everyone would move together and would show that united front, because viruses cross state lines without a problem. However, there's 4 counties that essentially it seems have jumped ship and are moving to that earlier time. If you look back, the original idea for the May 15th was that our peak was April 28th. The Institutes of Health Metrics and Evaluation, which IHME out of the state of Washington, has actually said that we've probably already hit our peak for the state of Missouri, and that it was for a week ago. However, all of the computer modeling says that we really need to keep what we're doing in place past May 15th in order to make sure we don't have a second resurgence. Looking back historically, I think it was SARS, when they went ahead and lifted some of the restrictions, they didn't actually see a resurgence until essentially, I want to say it was 4 weeks later, 6 weeks later. The incubation period was more than 2 incubation periods, which it's about 2 weeks is about 1 incubation period for COVID. And so us going out to May 15th, even if our peak was, over a week ago, actually allows us time to make sure that we're not going to have another resurgence. And it's important as we go ahead and start phasing back in to whatever we deem normal, that we're allowing that time in between in order to ensure that we're not going to see that resurgence. So, we have that data, and as a city, and I know as a region, it is being discussed. Some are not staying with everybody else and rowing in the same direction. But the City of Independence is doing their absolute best to try to keep everyone together, play nice, share as much data as we can, and we keep asking for what we can to make sure that our citizens are safe.
In terms of the Eastern Jackson County area that we're associated with now under the use of the Eastern Jackson County Board of Health, what are we looking at as far as the other areas that Lee Summit and some of the separate entities that, what are their decisions? What are their guidelines going to be at this point? How different are they from ours?
Well, they're actually looking within the next couple of days to start discussing what we want our different phases to look like as a region. I think Wyandotte County is actually supposed to release their plan tomorrow. I actually asked for it tonight, and they are keeping it close to the vest, and apparently they're not going to share it until they put it out in a press release. But as far as Eastern Jackson County goes, my understanding of the law is that because we fall under Eastern Jackson County, we can be stricter than Jackson County, but we can't be more permissive than Jackson County. So if Jackson County says that we're closed until May 15th, and on May 16th, restaurants and everything else can reopen, well, we have to stay at least closed until May 15th. But on May 16th, if we want to keep sectors closed, we can. Now, ideally, what we would like to do is the same thing that Lee Summit and Blue Springs are doing. And I know that our mayor has been very, very good at keeping in contact with them. I know that they have weekly meetings, and I'm sure that they talk more often than to discuss what the plans are and trying to make sure that everyone is going to move together as a group.
Okay.
I know Jason had brought up contact tracing. So that was actually the subject of a call. The city has offered, because they're such low staffing, the city has offered publicly to not only have our Medical Reserve Corps assist with contact tracing, but our fire departments have also offered to assist with contact tracing. As many of you, I'm sure, know, our Medical Reserve Corps, they're made up of, physicians, nurses. These are people who are well aware of what questions they should be asking and have had that HIPAA training. Our firefighters, they're EMTs, they're paramedics. They've also had that training, and they're used to asking those questions and making those connections with people.
Christina.
Yeah.
Is that contact tracing under the direction of Jackson County?
You're a little quiet on my side. Let me turn you up. Say again?
You said, is that contact tracing under the direction of Jackson County Health Department?
It would have to be, because they know who came back positive and who didn't.
Right.
So we have, sorry, go ahead.
No, that's what I was just making sure. I mean, there's, they may be medical professionals that understand why they're doing it, but there should be a standardized way to do contact tracing that is ran under the direction of public health investigators.
Yes. And I know that Wyandotte County and Clay County are both using volunteers right now to assist with their contact tracing. And Wyandotte County has actually come up with a set training for their contact tracers to do. I understand that their contact tracers are medical students, and they went ahead and essentially have an online training for them to do, and they're using 40 of them right now to go ahead and make those calls. They did all the training. They said that they've been doing this with them for the past 2 weeks, and they are extremely pleased with the results. That it's been working out great for them, because they just do not have the capacity. And what they did is they not only set up for them to undergo training, but they have some of the more advanced or adept students essentially as leads to assist some of the others. And then they all fall under the EPI for Wyandotte County. And that the EPI does daily phone calls with the group to answer any questions, make sure everything's going well, follow up on any issues, and that it's been working phenomenally for them. Clay County is doing something similar. And so the request was maybe Wyandotte County could share some of their information with Kansas City and Jackson County on how they were doing that training and how it's set up. Because, it would be ideal, of course, for all of our health departments to be perfectly staffed with just the right number of people in order to respond to these sorts of emergencies. But We all know that getting staff on takes time. There's a set of volunteers that are ready and willing. And because contact tracing doesn't need to involve actual contact with a patient, it's very low risk to those volunteers. They are just on the phone and they can do that contact tracing. They can do it from a central location, but they can also do it just from home. So it's a fast way to do it and to ramp up.
So are we looking to gather more volunteers then to help Jackson County with this approach, assuming they get Wyandotte County's plan?
So we have publicly offered now multiple times volunteers, and as of at least today, the answer has been thank you, but no. So we're hoping now that Wyandotte has, since they've come forward and Clay County has come forward and said that volunteers are working great for them, that Jackson County will reconsider. But we will see.
So what is their concerns? Are they worried about the volunteers not being well trained, or are they looking at paid staff only performing the duty?
They would prefer paid staff only. They had concerns, at least that they've expressed, that training would take too long, that there would be too many issues with HIPAA. They expressed that not everybody has their TB test or any of these other things, because Jackson departments, of course, ran by Truman Medical Centers. Wyandotte and Clay County pointed out that they don't have to worry about those things because those are never coming into contact with patients. So it's not a real concern.
You do have to keep in mind Jackson County is a different type of health department compared to all the rest in the state, being affiliated with Truman, which then brings a lot more regulations and hoops to jump through, but that's just is what it is.
Jason.
I mean, I lived through this with H1N1, and we rotated staff around, and we ended up getting money and able to hire more later on. But there's certain things right now that Jackson County is not doing so that they can do contact tracing. I mean, there's certain activities that just aren't as important right now, so they can shift people around to help with that. So I wouldn't necessarily be under the assumption that they're not doing anything.
Jason, what are the issues? What are the issues with HIPAA that they might be concerned about?
I'm not an attorney, and it has been a while since I've been HIPAA certified, but I'm not sure. The federal government regulates HIPAA through the Office of Civil Rights, and they put out a waiver very early. And buried in the HIPAA when it was originally written, there are recognized exceptions during a time of national emergency. So the issue of contact tracing would be one concern, because you do have individuals that are making, if I understand contact tracing correctly, they do need to have the patient information to make that contact tracing. Totally different set of conversations around providing aggregated data about this pandemic in a manner that cannot identify a patient, which would be aggregated data about Independence or Eastern Jackson County, so that people know the number of tests, number of positive, number of deaths, and trend lines. So I'm at a complete loss how you don't release that. That just sounds, and I appreciate Christina's early admonition that we don't usually get a lot of attendance at our meetings, but maybe people are watching tonight. But this sounds like just a load of garbage, and it goes back to the expectations that are extraordinarily low that many of us have about the competency of county government in Jackson County. So I came into this meeting so pleased with how our community had geared up and responded to it, and I assumed we would then be thinking through and providing the collective advice on how we're going to be stepping away from this. And you all are the technical experts, but I don't see how anybody reaches decisions if you're not providing data and data over a period of time in which to assess that. And they haven't given you data. So how does independence make decisions if you don't have the data to make the decisions? So we're forced to live with the decisions of others that aren't releasing the data for anybody to look at, to ask questions and challenge their assumptions of that. So that makes me really uncomfortable when people are hiding things. And right now they're hiding it, and that's inappropriate. And I sort of wish we'd have had this meeting earlier if this malarkey was going on. I vote for some of those guys, and tomorrow I'll call the ones I vote for and indicate my disdain for their incompetence. Oops, I guess I shouldn't say those things if I'm wrong.
Well, and I would remind you that we do have some data which we're allowed to track, but they made it very clear to us that we were not allowed to release it. And so I believe there's 3 of us in the city that are allowed to see it.
But they're giving you address data to load into your dispatch CADs. Is that the data on what you need to be making decisions on where this is going so that you can advise our city council and mayor on timing and how to phase in and open it?
We need additional data. I will not lie to you.
Thank you.
You know I won't.
Yeah, and that data is. Lori was very kind to send me the links to the Jackson County data, so I can tell you what percentage of people with the disease are Caucasian and which are African American, which is disproportionate and not appropriate to the population, which is a whole nother topic about why that's occurring. But you just can't find that data. You can't find that national data. We do appear to be trending down, but I don't know where a lot of that data is actually coming from.
Well, that seems to be one of the core issues here tonight, the idea of the data, the limited access to it, and the limited amount of data that might be collected, especially the contact tracing.
Well, without contact tracing, you're also not going to stem the disease. You just won't. And we're not able to test those people who are asymptomatic that want to be tested. It's quite a conundrum.
It almost seems like one of the first things that should be put in place when something like this is starting to develop is that contact tracing. The quicker you can identify the tracking of the disease, the quicker you can make an effective, and you might even shorten this whole event period.
Yeah, contact tracing is absolutely, vital. And Jackson County, I'm sure, is doing some contact tracing, but I know that they are not using volunteers at this time. And I know Wyandotte County is using 40. So I am concerned.
Have they given you the plan, the contact tracing plan on pretty letterhead and 3 pages that spells out how they're going to do it, the flow of information, how they're going to train people, where they're going to acquire those people? I mean, that's not hidden under HIPAA, and you're not indicating they've given that to you. So how is that a secret to help the community feel comfortable as we try to struggle towards helping to advise our city on opening up? Do you have it?
No.
Okay.
No, I do know that they have purchased some new software to assist them, and that they are very proud. They're the first in the state to have the software. I cannot tell you what that software is, but I know it is supposed to help assist them with contact tracing and with making sure that, if it ends up that there are two people who have, are working together, that they can actually tie that together a little faster than just individuals. But
By the time they get it all put together, it will be in the midst of the next pandemic.
I have no comment.
Two people just doesn't sound reasonable.
Well, the two people would be the two people who, I'm sure they're using more people than that, but I know that there have been some, there have been cases that have been posted on Facebook of different area businesses. And their thoughts is that this software would help them know faster that those people were all working in the same location, that they knew each other, that they'd been in contact with each other, so that they could identify those potential outbreaks faster. I hope they're right. I don't know the software, so I can't speak to it.
One would think, however, if you ask them where they work, they would tell you.
Well, this is all public information. You'd think it would be readily available and much quicker than what it is.
Christina,
Yes.
is it possible to invite Jackson County to another follow-up meeting to this to get some of these answers? Or do you think they would not want to attend?
We can, of course, always invite them. They are invited to, we have meetings several times a week for stakeholders with the city. Not only does city leadership attend, but we also have the chamber on there, the school districts, the health department is invited. They have not provided that sort of information on those calls, so I'm not sure that they would be more forthcoming to answer those questions for the board.
Maybe some things they don't provide, but maybe they give us an answer as to why they're not.
Yeah. I can always ask.
Yeah, that's.
I thought.
Any other thoughts?
I think that's a neat idea. So I really did. I'm apologizing again. I was so tickled with with my knowledge base, how we were protecting the community, and this is very disappointing. So can we? Is it possible we go ahead and ask for further input and try to come back together here in a few days? I know this is a stretch on city staff for these things, and they're not having other boards and commissions because it's just complicated to do this stuff, and then doing things from your home. So I try to respect that thought. But it seems like I don't know how we do our role in our community without answers to some of the questions that have come up here this evening.
Well, and maybe, and I don't know if the board accept this as a compromise, but perhaps what if I put some of these questions together and sent it and asked for a formal response that could be shared with the board? Whatever they would be saying to the board would be public anyway. And so ask if Bridget will give a formal response. That way we don't have to have a formal meeting. Yeah.
Yeah, I'm
and
sure
still share it then with you guys.
Yeah, I'm sure they have a lot of meetings in a general rule of thumb, and so that would probably be a more appropriate way to at least initially try to communicate with them and give them the time that they need to make a response, and then we can follow up on that with another question session if there's more that we need to know. Okay. Sounds like there's a little bit of a lull. Is there any other thoughts that somebody's kind of holding back on that they would like to share yet? Okay.
My biggest,
Only this. Christine, was there
Okay.
anything that the city was asking of us, or what's, were there questions from this group that need to get back to city officials? To what are they looking for from this body, other than what we've just described here? We would like to have more information regarding contact tracing and then the prevalence in the community to make better decisions. Is there anything beyond that you're aware that was posed to this group?
I know that there had been an initial discussion from Jason, and I don't know if Jason's still wanting to pursue this. Us, Jason, I know he was the original, he had an original idea.
And that doesn't happen very often, like every century. The thought had been, and again, I was approaching it from my personal standpoint, and I had been impressed with how I thought in the comparing nationwide, the recognition and the movement towards what actions the government can take in encouraging citizens and within their legislative power. And so I thought that was appropriate. And a while back, Dr. Ruckman and I had discussed, should the board try to engage? And the early thought was, well, no, the city is moving ahead with its actions. And then as everybody started to see a termination point of this, we rebroached the conversation of, well, should this body bring its expertise to bear to advise the city? I woefully thought that there was adequate answers to these basic questions. And frankly, I thought we were headed towards a short meeting and a resolution saying, yeah, it sounds like things are going well, like I thought they went well at the front end of this. And I no longer harbor that opinion. So that was the original idea, Dr. Reddy. It doesn't sound any good at this stage of the game.
welcome to the club, Jason.
So, are there any other thoughts that anybody has that they want to express at this time?
My only thought would be, I know the city is stretched thin, and although the president denied that it was going to happen tonight on his little news conference, we're going to be visiting this again in September or October. If it follows what the H1N1 flu did in 1918, which it will, we're going to have a second peak and possibly a third peak. And I didn't know if the city was currently, or if they're just struggling dealing with the situation they have, or if they're making plans for how to do this better in the fall when we deal with it again. And in 1919, more people died from H1N1 than died during the first peak. So our services need to be ready for that onslaught. And now's the time to think about it.
Absolutely. The city has a separate group, which is, in constant contact with the incident command team. And they're the futures team, where they're not only looking at how we open up, but what do we need to change? What do we need to look at going forward? The command team is very aware that this may indeed, of course, come back. So we are constantly talking about things that we would do differently, things we would do better in the future. We have that after action report, Wash, that we've already started. There are definitely things that we know did not go as perfectly as we would have liked them to. And this has definitely been a learning experience, I think, for every single person who's been. So we are looking at that. We are trying to prepare. We are trying to make sure that if and when, whether it's COVID-19 or whether it's, COVID-23, that we're ready and we have a better idea of how to handle it and where the possible problems will be. We're hoping, that we'll be able to have all the data we'll need in order to make some of those decisions. A lot of it, we're just making sure that we're participating in those regional discussions, and learning from others as we go. We're trying.
Just that we have a 6-month window before we're visiting this again. And, you can buy toilet paper easier than you can buy PPE. So, my friends on the front line are wearing the masks that my wife sewed for them, which are not what you ought to be asking medical professionals to deal with. So
No.
Our firemen and policemen and ambulance drivers, those people need the gear so that they're not dying for our cause.
Well, and the good news is the Independence Health Department had some wonderful people in communicable disease and immunizations that made sure that we were prepared for emergencies, and had purchased a lot of masks. And those masks went into storage when the health department transitioned. And so right now, our public safety personnel do have the masks that they need. That supply will not last forever, but it has time in order to make sure at least that those people are safe, and then has allowed us to work with Mark to see if we need to buy, regionally as a group, to make sure that we have supplies for the next round.
Well, that obviously is not an unreasonable expectation for the next time around if you're prepared. You've definitely 6 months. It's not long enough to really give you a lot of time, but it's definitely at least a little bit of headway that you can actually get something done between now and then. But you got a lot to do just to clean up after this event.
Absolutely.
Okay. Any other comments? Any other thoughts? Okay. Well, all of what in favor of adjourning this meeting, raise your right hand. Meeting adjourned.
Thank you.
Thank you.
Take care.
Oh, Christina.
Yes.
As far as the next meeting, we're looking at, what would you recommend a time frame for anticipating it?
Well, our next regularly scheduled meeting would be June. I can't remember what day in June, but that first Thursday in June. I would hope that everything will be, that we'll have at least moved into phase 1 at that point, and we'll be able to have a meeting. It may be a meeting like this again. If the board feels it necessary to have another one, just reach out and let us know if it needs to be in May. I'm going to work on our response to Jackson County, and I'll copy you, Dr. Ruckman, on it to ask that some of those follow-up questions and see if we can get a formal response. But otherwise, June, if you guys are okay with that.
Okay, well, we'll see what transpires between now and June. Obviously, it sounds like we had a few questions that would still like to be answered before then. So I presume that we'll probably have a meeting before that.
Well, and if it's a public document that she sends back, then we should be able to share it without needing a meeting. But if you guys have follow-up questions to it, then we would need to the next regularly scheduled meeting is in June. But if need be, we can have one earlier than that.
Okay, we'll try to minimize the need for it, but I just wanted to make sure that we were anticipating that if we were going to have one, we make sure we took and considered that before the June meeting. Okay. All right. Thank you. Take care. Have a good evening.
Thank you.
Bye now.
Bye-bye.
Bye.